right, so the next part, we're going to look at some prescription orders. Now, in the training database and in our corporate documents, you are able to do this yourself by using a training login. You're going to create a fake resident, and we have discharge papers from a fake resident that we put into corporate documents. So get with your CEC to get all of this paperwork. Once you're done with these videos, you'll sit down, you'll have the discharge, hospital discharge orders in front of you for our fake resident. And we also have the printouts to show you exactly how the flow sheets or the MAR is supposed to look once you're done. So yours that you do in practice should match exactly what we have in our training database. So I'm going to go through a couple of those orders that you're going to be working on here in just a little bit and show you how they're going to work and how to get started. So over here, I'm going to add order again. The type of order, well, I need to look at my orders and see which one I need to start with. So the first thing that I have is a multivitamin tablet, and it's 1 tablet by mouth once a day. That's a prescription order, so I'm going to click on prescription. Notice that when I did that, my provider automatically on prescription orders went to the pharmacy that I put on my resident's face sheet. If you choose prescription order on your resident, and this is telling you to select one just like that, then you do not have a pharmacy listed on your resident's face sheet. You need to go back and do that. So type is prescription. I'm going to say next. This wants to know, enter a brand or generic drug name. So this is my little search box right here. So what I'm going to do is just start typing multivitamin. And when I do that, notice that everything that I kept typing, that list below kept changing. So it's going to give me its suggestions based off of what I'm typing. I typed in multivitamin. I decided to type in the word oral because as we saw, I had like 30 options to choose from. I'm going to click right here on multivitamin oral. And when I do that, it breaks it down and it gives me 2 different choices for this drug. I have something that's in a tablet form right here, or I have one that is in a capsule form. Now this said 1 tablet by mouth once a day, so the tablet is the route that I want to go. I will select tablet. And when I do that, I'm brought to my order entry screen. So receive date, start date up at the top, received by myself, end date. If this order did have an end date, I could uncheck open-ended and I could put in my stop date for the order. Your receive date and your start date, in most cases, these should be the same, so long as you have that medication on hand. So if you get an order, and this is very important to remember, so I'm trying to help you set yourself up for success rather than failure. If we have an order that we get today from a physician, but that order is not in stock, it's not in our Pyxis, it's not in our EDK, we need to get it from pharmacy, that's the only way we're going to get it, then it would benefit you if your receive date would be today, because that's when we received the order, but our start date was tomorrow. That way it would give pharmacy time to deliver the medication and then we could start it. Otherwise, if you're on EMAR and we do receive date and start date both today, this thing is going to trigger as soon as it's due. And if you don't have that medication on hand, then you just had a hole in your MAR to where you weren't able to give that medication. So think about that when you're putting your orders in real time at your building. So below that, customize, that does not exist for you, so don't worry about it. Right here it says drug name, multivitamin. Drug class, vitamins and multivitamin preparations. This drug class right here is going to be your best friend. The reason I say that is I spoke of the side effects earlier in the last training. And the side effects are very specific to the drug class. So this right here is going to be your indication. If you read it, anytime you put one in, and it'll tell you if it is an anticonvulsant or an antidepressant or an antipsychotic. Any of those, it will let you know the drug class. That way, it's kind of your reminder that, oh, I have an antidepressant drug. I need to go and add the antidepressant side effect. Okay. So drug class comes in very handy. Schedule says not scheduled, but you're saying it's once a day. that's related to class 2, 3, 4, 5s. NDC code is already set on it. The form is a tablet. To the right of that is a box that says crushed. Okay. Never, ever, ever check this box. Ever. Just don't do it. I wish we could get rid of it. We can't. Don't check it. We already have an order for this resident that says may crush medications. That's all we need. That's saying may crush. We don't have to crush. By checking this box, you're saying this medication has to be crushed every single time it's given. Okay, don't set yourself up for that. We already have the may crush order. We're good. The strength right now is not listed because it's just a multivitamin tablet. The route says oral. So if I look, I have multiple options to choose for on a route. If this resident was a G-tube, I could pick G-tube. Now, Matrix is pretty smart, but sometimes it's not. So I could say that this was to be given nasally, and it would accept it. And so be careful with the routes that you choose. Make sure they are accurate. But some of the other options in here that I want to show you that are very, very helpful. Right here we have both eyes, both ears. If I look down, I've got left ear, left eye, or right ear, right eye. So use these if you have drops that are going to a specific eye or a specific ear. Use these rather than trying to type it elsewhere in the order. Okay, the route is always where you want to put that information. Amount to administer. All right, so this one is one of the very few exceptions that we have. Because there's no strength listed up here at the top, I can't put a strength in here. Our amount to administer that we want on prescriptions is the total dose. So whether that's milligrams, milliequivalents, micrograms, we want that number in here. We don't want 1 tablet, 2 tablets, 3 tablets. Okay? I need to be very clear on this. We see it over and over and over again. We want total milligrams. The reason we do that are not just milligrams, but the total dose. The reason we do that is we never know what pharmacy is going to send you. So if you put 2 tabs in here, but pharmacy sends you a double strength, then you're going to give them 2 double strength tabs. Now they have double the dose that they were supposed to get. Okay? If you have a potassium 20 and you just put 1 tab, but then Pharmacon sends potassium 10s, and you're supposed to be taking 2 of them, but the computer tells you just to give 1. Okay? That's why we always put the total dose in here. Again, this multivitamin is one of the very few exceptions to that rule. Because there's no strength for us to list, and because a multivitamin has multiple ingredients in it, we are safest, for this example, to say 1 tablet. The order again was by mouth once a day. So I'm going to look at my frequencies. In my frequencies, I have FYI, I have a 6 a.m., a daily, I have a warfarin, bedtime, twice a day, 3 times a day, 4 times a day, every shift, every 4 hours, every 6, every 8, every 12, as needed, once 1 time, 5 times per day, and every 15 minutes. So with these frequencies, they are a starting point for what we need to do. So just because I pick daily, I'm not locked into 8 a.m. or any specific time for that matter. And I'm not locked into this being repeating every single day. I have options. This is just where I can start, and then I can manipulate this frequency and all of this information down below and make it read exactly how I want it to read. So the frequency, we always just want to get as close to what we need as possible. That's where we start. For us, frequency is daily. I'm not going to have to change anything in this down here because it's exactly what I need it to be. It tells me it's once a day. It's a specific time. Okay. If this were going to a shift, I could make it a shift instead. So it's still once a day, but now it's for day shift. I could say once a day as needed. That's how we will do our PRN orders. I know that there is an as needed right here, but we rarely, if ever, use this frequency right here. All of our PRN orders have a schedule to them. They're either every 4 hours PRN or they're twice a day PRN. So we will always pick the schedule first, in this case daily, and then tell it PRN. So once a day as needed. And if I did custom, I could build my own time range that would fall outside of the spectrum of a typical shift at a building. So we have options right here. For mine, I am okay. This was at 8 a.m. before I changed everything. I am okay with this being once a day, 8 a.m. Right below that, we have select the first scheduled administration on 11/10 and indicate other initial administration or override time on 11/10. The only time we're going to deal with these right here is when we're using an antibiotic. An antibiotic, as you know, is going to be very specific to the amount of doses and the number of days that it is to be given. So that's the only time we're really going to mess with these. My repeats on is daily. That's exactly what I want. But I wouldn't be stuck with this if I didn't need to be. So instead of it being daily, I could say that it was cyclical. And by cyclical, I can say that it could give it 1 day, don't give it 2 days. That would make it an every 3-day order that you would use for, let's say, a fentanyl patch. I could go with every other day, just the even days of the month, or just the odd days. Another option I could pick up here other than cyclical is weekly. And weekly, we saw this one when we did the daily weights on those admission orders. So by picking weekly, I could just say that it was just on Sunday every week or a Wednesday. And then we have monthly, which we saw when we used the annual PPDs. So we could go to choose months, pick just the month that this was occurring in, and what day of the month that it was happening. For hours, we need this to repeat every single day. We're going to give this multivitamin every day. The next thing we need to do when putting in a prescription order is every prescription that we put in requires an ICD-10 diagnosis. If you remember back to when we admitted this resident, and on the face sheet, we added one very specific diagnosis that you as a nurse are okay to add. Again, we're going to let MDS add all the remaining diagnoses. They have been trained in that, and they can make much better selections out of the millions to choose from than you or I could. So the one that we are allowed to put in as a nurse is the Z51.89. All right, and that is the encounter for other specified care or aftercare. So I'm going to select that. Notice that the ICD-10 is bold, so I have to pick one, otherwise it won't let me save the order. But here's our golden rule related to this diagnosis. If I had 20 diagnoses in here to choose from, I would pick the one that I needed for this specific medication. That's my first thing. Always find one that works before we settle for this Z51.89. This is a last resort. I repeat, this is a last resort. If you do not have one in the diagnosis to choose from that fits the reason why we are giving this medication, then we would pick this one. The follow-up to picking this is now we need to come up into special instructions and we need to add why we're giving the medication. And how we're going to say that is by typing indication, and in this case, it's a supplement. Okay, so if this was for depression, my indication would have been depression. Now, hopefully we would have a depressive disorder diagnosis that we could choose from the list down below. But if we didn't, then we would pick the aftercare, and we would say indication, why we're using it. Very important that you follow those steps right there. Down below that, we have no tasks to record. It's telling me it's going to put it on the medication flow sheet, ordered by, there's my attending physician, order source. Now, had the nurse practitioner, the NP, written this order, I would be picking the nurse practitioner's name. Reason for that, your physicians and nurse practitioners are now going to be signing all the orders electronically. So it's very important that we pick who wrote the order, because then it goes into their queue in Matrix for them to sign off on. If you don't pick the right person, then they never are going to sign off on that order. Order source, right here, we need to know whether it was a telephone, a verbal, or a written order. I received all these on the discharge summary. They were written orders for me. Provider, there's my pharmacy. Send fax. Right now this says do not send, but as you are live in the building, this will tell you that it's going to send. And once it has sent, this will show you your confirmation that it went through successfully. Right below that, we have pharmacy directives. Dispense directives, the first one that we see, if I drop down the window, I have dispense as written or substitution permitted. The only time we would ever need to pick one of these two options is if it was a dispense as written order. We already have an order that says generic equivalents are okay. So the substitutions, we already said that's fine. And pharmacy is going to send you the generic unless you state that it needs to be brand name only. So in that case, we would do the dispense as written. We have an option right here that says do not send medication. So if this was an amended order where something went from, let's say, twice a day to once a day, and you're still sitting on a full card of this specific medication, so you still have 30 of them, and you don't need pharmacy to send more right now, it will still transmit this order to pharmacy, and they will replace the old order with the new one that you're putting in right now, but they'll just hold off on sending it because they know you already have some stock that you need to go through first. So that's how we would tell them to hold off. And don't worry, once you would reorder, they would send you the newest order that you put in. Right below that, other directives, we have none. We have taken from emergency contingency supply and the number of doses. So that is very specific to an antibiotic. If we were going to start the antibiotic out of our EDK or our Pyxis, then we would let pharmacy know that we are going to take this many doses out before they get to our building with that delivery. In doing this, it's always good to think forward as well. So if you're on day shift and you get an order for an antibiotic and we need to start it now, and it's going to be twice a day, we'll think about evenings. Will evening shift have that on hand to give to the resident? And if not, and if they're going to have to take it from the EDK, then we need to talk about both of us in this. So this taken from emergency supply is not just you, it's how many total we're going to take out before pharmacy gets to your building with the delivery. Okay. Taken from stock, number of doses, so it's pretty much the same thing. Other, this is where you could write a very specific note to the pharmacy if you needed to add something to an order. And below here, the two order set we do not use, so don't worry about it. At this point, I'm going to say next. And what it's taking me to now is a verification page. So this is my last chance to look at the order that I put in and make sure that everything is 100% accurate before I say save. When I say save, it shoots it to the pharmacy. If I'm on EMAR, it triggers it in the EMAR, and it's live. It's going. So make sure you review your work before you click save. So I have multivitamin. I have my dates are correct. I'm taking one tablet. Again, this is an exception on typing one tablet up in here. We are always going to use the total dose unless it's pretty much a multivitamin tab. 8 a.m. every day. I have my indication of supplement, which is good because I used my diagnosis of aftercare. It's going on my medication flow sheet. It was ordered by my attending MD. There's my pharmacy. Everything is good. At this point, if I needed to fix anything, I would click modify, and it would take me right back to the page that we were just on. Save and copy would be if I was going to put in multiple orders of the same drug. So if I had a few different strengths of acetaminophen that were given, one tab for this, two tabs for this, save and copy will keep the drug search and will allow me to just enter the next acetaminophen order quickly rather than typing it all back in. Save and link would save this order, but then pop it automatically up into the link section in orders so we could link other orders to it. Save and save and new. Save will take us back to the order section. Save and new will keep us inside the orders where we can just continue to add more and more. So I'm going to click save and new and work towards the next order. The next thing that I have is a calcium 600 with vitamin D 400, one tablet by mouth twice daily. All right, so what type of order are we going to pick? Correct. Prescription. I'll say next. So I need a calcium 600 with vitamin D 400. So I'll start typing the word calcium. Notice all these choices. I got calcium carb, cal carb, cal carb. So I need to keep typing. The best way on these calcium with D orders, I highly suggest typing the word calcium and then whatever strength the calcium is. So once I've done that, it just eliminated everything and it leaves me with just a straight calcium 600 oral. I've got a 600 plus D, so I need to look at this one and see if it has the one I want. I'm going to click on it. Right here at the bottom, oral tablets, I notice I've got another one that is a capsule down here that's a 600-200 capsule. Here's a 600-200 tablet, a 600-125 tablet, and a 600-400 tablet. So there's my 600-400. I'll pick it. My dates are good. Amount to administer. You can leave out that 1500 milligram that's in parentheses on this one. Just 600 milligram, 400 unit. It's oral. We said it was twice a day. So I'm going to come to my frequency list and I'm going to pick BID. Times are 8 and 4. That's what my BID med pass is. So I'm good there. Repeats every single day. That's what I want. Now I know for a fact that I only have that aftercare diagnosis. So I'm going to go ahead and put in my indication, knowing that I have to do an indication whenever I pick this aftercare diagnosis. Again, this one would just be a supplement. No med notes or vital signs required. Medication flow sheet, ordered by my attending. Order source was written. I will click next. My verification page. So I'm going to make sure this is all good. All my information is correct. It's the right resident, right strength, right drug, right route, right time of day. And then I'll click save and no. So if you noticed, that order that we just did was a fraction of the time that it took us to do the first one, because I had to explain all this stuff within an order. So we're going to keep on moving. The next type of order that we have is a Coumadin 4.5 milligram daily. So it's going to be a prescription order. I'll say next. So it's a Coumadin, but I know they're going to send me warfarin. So type in warfarin, and I get warfarin oral or warfarin bulk. Anytime that you see bulk listed in here, it is like a tub of it, just a tub of powder. So unless you are making your own medications at the nursing home, don't ever pick bulk. Warfarin oral, I'll select that one, and I have some options to choose from. I have a 1, I have a 2, a 2.5, 3, 4, 5. So there is no 4.5 milligram warfarin. What I suggest you do at this point is, if it's not already printed off and at your nurse's stations, in your corporate documents, under the matrix instructional documents, you will find a cheat sheet that shows you exactly how Pharmakon will send Coumadin doses based off of the orders that you send them. So if we send them an order for Coumadin 4.5 milligram daily, that cheat sheet will tell me that they're going to send me a 2 and a 2.5. And I'm going to give them together to get my 4.5. So use that cheat sheet as a reference, because we want to enter them into Matrix the same way we're going to receive them from pharmacy. So I'm going to start by picking the 2 milligram. My dates are good. My amount to administer. So right here, some people would think, oh, I'm going to put 4.5 milligrams because that's my total dose. Wrong. We are just talking about this tablet right here. So with this tablet right here, it's only one of them that is going to be given. So it's 2 milligrams. My frequency, I have one that's pre-built that says warfarin, and it's to be given at 5 p.m. Again, I know my aftercare is the only diagnosis I have in there, so I'm going to do indication, and let's just do CHF. My diagnosis, none of these are required. Flow sheet is set to medications. We talked about this earlier, though. Do you see another flow sheet in there that would make more sense for this warfarin to go on? Yes. Anticoagulant. Below that, we have ordered by. So again, our attending MD, our order source, written. Now, if your order source was verbal or telephone, please select the appropriate one. So right now, I could go ahead and say next. I could check my order and save it. But we're going to take one extra step on this order, and that is in the special instructions. I need to talk about the fact that this 2 milligram tablet is going to be given with a 2.5 milligram tablet to equal my 4.5 milligram dose. So again, up here in the amount to administer, 2 milligrams. That's it. Down here in the special instructions, this is where I'm going to say give with the 2.5 milligram to equal 4.5 milligrams. That's where we say the total dose, not up here. I'll come down to the bottom, say next at this point. So I've got my 2 milligram tablet. Everything's there. Give with 2.5 to equal 4.5. Now, this is where the save and copy comes in handy, because I'm going to do another order for warfarin. So if I click save and copy, it takes me right back to my warfarin. I don't have to search for it. And I'm right back here. So I'm going to pick my 2.5, my amount to administer, 2.5 milligrams. My frequency, again, I'm going to pick the warfarin, 5 p.m. And when I did the save and copy, notice what it did. It kept my special instructions, it kept my diagnosis, it kept my flow sheet, so it remembered all that stuff for me. So there is some value in doing this save and copy when it's appropriate. Saves you a couple clicks. But this one, it's only going to be given with the 2 milligram tablet because this is the 2.5. So it copied everything else from my previous order. Flow sheet anticoagulant ordered by my attending. Order source written. Next. I check all my work, make sure that it's all good. And once I do that, I click save. All right, so the next order that we have, we're going to talk about a DuoNeb treatment. So it's the albuterol ipratropium bromide, and the order says per nebulizer every 6 hours. So we're going to add order. Type of order, again, we're going to go to prescription. I'll click next. And so I'm looking for the albuterol. And if you notice, I just have albuterol sulfate, sulfate oral, and sulfate bulk. Okay, I don't want any of those. And if I start looking for the ipratropium part, you notice that no search results are coming up. Okay, so I need to start my search over again. A lot of you are probably thinking, why don't you just type in DuoNeb? Well, DuoNeb, by its name, is no longer manufactured. So this program works off of the First Drug Database. If something is no longer manufactured, you're not going to find it under that name searching it through here. So I know for a fact DuoNeb does not exist. So my only other option is to start with ipratropium. And if I look, I get my hyphenated ipratropium albuterol inhalation right here at the bottom. So there's my DuoNeb. I'll select that one. If I look, it's the ipratropium albuterol, the 0.5-3, 2.5 milligram base per 3 mLs. That's the one that I want. I'll select that. If I'm looking, all this stuff is filled out for me again. My dates are right. I have no stop date on this order. My amount to administer, instead of typing all this out, this is another one that has an exception. So rather than typing out all those milligrams, this one is okay if we just put 1 vial or unit dose as the amount to administer. The frequency says every 6 hours. So for my frequency, I'm going to come down here and I pick every 6 hours. Now, for your building, whatever your Q6 hour frequency is, once a day, twice a day, 3 times a day, we have already worked with your building and your management to decide what times they want to show up when you pick these frequencies. So whatever it automatically sets to is what we're going to go with, unless we have a very, very good reason to break away from what has already been established. So in this case, every 6 hours for this building is 12, 6, 12, and 6. If I needed to change these, like again, if we had a very, very good reason to change what automatically pops up, if you notice, I can't change this 12 to anything, I can't change this 6 to anything. I don't have any options. That's because Matrix will figure out what every 6 hours is for you based off of your first administration time. So if I needed to change these, let's say that it was at 8 a.m. is when it started. I changed my first administration time to 8 a.m. and then I would come over here to calculate times. Once I do that, now it's at 8, 2, 8, and 2. But again, my building was set to 12 and 6, 12 and 6, so I'm going to leave them. My ICD-10, again, is the aftercare, so that means I need to do what? Absolutely. I need to write in my indication. We'll say COPD. And then we look down here at our tasks to record and our med notes. There is one that we need on here. So when we do NEB treatments, we always record the minutes, correct? Yes. And then we do our before, during, and after. Now the before, during, and after, those are all separate orders. Those are pre-built for us in our standard order list. We just need to go find them. So on the actual prescription itself, the only task to record that we are going to add is minutes. We always want to record the minutes with the prescription. As far as the heart rate, respiratory rate, and breath sounds, we're going to do that with those pre-built orders that I just spoke of. Those do not go on this order. So I have minutes. My flow sheet says medications, but it should probably go somewhere else because it's a NEB treatment. So it is going to go on respiratory. Ordered by my attending. Order source was written. And I'll come down here to the bottom and say next. I'll review my order, make sure everything is good. And if it is, I'm going to say save and new. Now, to finish out that NEB order, I need to go into my standard order respiratory. So right here. I'm going to pick those. I'll say next. And in here, we'll see what type of orders we're dealing with. We have oxygen, SATs, PRN. Oxygen at blank liters per nasal cannula may titrate to keep SATs greater than something percentage. Oxygen at blank liters per minute per nasal cannula as needed. Oxygen SATs, ear protectors and O2 tubing. Change oxygen tubing and humidity every week on whatever day is your building changes those. Change NEB tubing set. We need this one. We didn't need the oxygen tubing set because our resident's not on oxygen. They're just on a NEB treatment. So I'm going to wake this one up. And right here, instead of typing out the day of the week, I always just remove this last part. So it just says change NEB tubing every week. And right now it's set for once a day on Sunday, day shift. But I know in our building, it's night shift that changes those. So I changed my shift to night shift. It's set for Sunday night, which is what we want for my building. If yours is Monday or Tuesday, this is where you would select those days. And I don't need any tasks to record on a change NEB tubing. It's automatically set to go to my respiratory flow sheet. I just pick my attending MD. And now I'm looking at my observe orders. So this one NEB order literally turns into 5 orders in Matrix. We have our prescription, we have our change NEB tubing, and then we have our observe before, during, and after. 5 orders. So I'm going to wake this one up. And your biggest help here is just to read the description. So this says observe heart rate, respiratory rate, and breath sounds before each NEB treatment. So that tells me which of those tasks to record I need to pick. And I need to schedule them in this exact order. Heart rate, respiratory rate, breath sounds. I'm going to show you how to do that. So the frequency automatically sets to 4 times a day. You might think, oh, well, that'll work. I'm not going to change this. The NEB itself was every 6 hours, which is 4 times a day. But that is not the case. Our frequency here needs to match exactly what our NEB or our prescription order was. which was every 6 hours. These need to trigger at the same time that your neb does. So if I look back up at the description, I have heart rate, respiratory rate, and breath sounds. So if I come down here, I'm looking at heart rate, which is my pulse, respirations, and down here in the bottom in med notes is my breath sounds. But I want them, when they print or when I'm working in EMAR, to show up in the order that it's listed above. Heart rate was first, respirations were second, breath sounds were third. So to do that, these little boxes over here to the right of them woke up whenever I put a check mark in there. If you notice, if I try to mess with the temperature one, it won't let me. But if I look at the pulse, it gives me 1 through 14. Okay, now these numbers don't mean that I need 2 boxes for pulse or that I need 5 boxes for a pulse. This is saying, what order do you want these to print in? Now that you have 3 of them selected, how do you want them to show up? Pulse was first, respirations was second, breath sounds third. Flow sheet is respiratory. If you look again, the ordered by was all the nurses' names, so you would pick your name out of this list rather than your doctor's name, because this is a nursing order, not a physician order. Here's the next observe. This one says during, but notice during just needs the heart rate and the respiratory rate. There's no breath sounds for during. Kind of hard to listen to that when they have a mask on, right? So again, change our frequency to every 6 hours. And right here, we need our heart rate, which is going to be first, and our respirations, which will be second. Ordered by, again, that's going to be me. And lastly, here's our after. And again, it has all 3 of them. Heart rate, respiratory rate, and breath sounds. We want them in that order. So I'm going to change my frequency to Q6, just like the rest of them. Here's my heart rate, respirations, breath sounds. Now, if your building also does O2 sats with these, then you can add those as well. Last one says protective barrier wipes, and then oxygen at blank liters per nasal cannula. So I'm good with those. I'm going to say save. I'm back to my orders page, which now I need to link my observe orders with my neb treatment. Again, if you're using the paper MAR, this is going to be very beneficial for you. So to do that, what am I going to click on here at the bottom? You got it. Add order links. So the first thing I'm going to do is I'm going to look for my DuoNeb. It's right here. So I'm going to add link. It's up there at the top. And then I need to go find my 3 observe orders. So here's my before. There's my during. And there is my after. Scroll back up to the top. Now they're all sitting in here. This is where those black arrows come in handy, because we want to do this in chronological order. So what's the first thing you're going to do out of each 4 of these orders? You're going to observe the heart rate, respiratory rate, and the breath sounds before you give the neb treatment. So that's the first thing we want to do, so we should make that the first thing in the list. I'm going to click the up arrow over here to the right. Now my before is the top order. So it's going to be before, then we give the neb, then we observe during, and then we observe after. That's the order I want them in. I'm going to click save. And now that one's done. As far as the warfarins are concerned, we could link those as well because they're being given together. But when we think about that, these 2 orders are both on the anticoagulant flow sheet, which means they're going to print on their own page of the MAR. So we really don't need to link these because right now there's nothing else going on the anticoagulant flow sheet. These are the only 2 orders that are going to show up. The next thing we have in line, we're going to do a sliding scale. Now, you're going to have more orders to do than what I'm showing you here when you do your practice. And I'm going to skip over a couple of those just so you can try to figure those out on your own. So the next thing I'm going to do is a sliding scale. It's a Novolog, and I have the sliding scale in front of me. I'm not going to read it out loud because it's kind of hard to remember anyways. So it looks like if it is less than 60, and then greater than 350, we're going to be notifying the MD. So on mine, the first thing I'm going to do, and you're thinking, well, we could go to standard order diabetic and look at it that way. But this is a sliding scale, so we're going to do it as a prescription. So the type of order is a prescription. I'm going to click next. I'm looking for my Novolog. Here's one I find that's subcutaneous. And it's my 100 unit per ml solution. That's the one I want. My dates are good. My amount to administer. Right here, for a sliding scale, we don't want you to type anything. Instead, you're going to come over here to the right. If you notice, this is the first time we've seen it. We have a box that says or per sliding scale. So I'm going to check the box for per sliding scale. When I do that, everything below this just changed. So follow me on this one. The first box says if blood sugar is less than blank, call MD. So I'm going to wake that one up. If you remember, I said that was 60. We're going to call the MD. The next one in line says if blood sugar is blank to blank, give blank units. So this is the start of our sliding scale. So ours is 150 to 200 is 2 units. So blood sugar is 150 to 200, give 2 units. What I'm going to do next is I'm going to click outside, anywhere here in the white. And when I do that, it gives me this little green plus sign. So it says add a new row. I want to add a new row. And when I do that, it automatically fills in the next in line. So I stopped at 200 here, so it's automatically going to put 201 in this box for me. I just need to fill out what it's going to. So it's 201 to 250 is 4 units. Add another row. 251 to 300 is 6 units. And then I have 301 to 350 is 8 units. My order also states that if it's over 350, so 351 or greater, that I'm going to give 10 units and notify the MD. So if blood sugar is greater than, I don't want to add another row at this point because my actual sliding scale is done. If blood sugar is greater than 350, which would mean 351 or above, give 10 units per my order. And the very last box that I want to check is if blood sugar is greater than 350, call MD. Perfect. There we go. So our sliding scale, let's say that it is 4 times a day. All right, so my frequency, I'm going to pick QID. And these times come up as 8, 12, 4, and 8. Now I know my sliding scales are a little bit different. So I'm going to do this at 7 a.m., 11, 4, and 8. That works for me. But notice when I changed out 11, it didn't change my PM to AM. That's a common mistake that happens. So whenever you're changing these times, make sure you change the AM and PM as well if needed. Otherwise, I can't tell you how many orders I've seen in Matrix where an 11 a.m. hits and it's not there in EMR for them to do it, and the nurse asks me why, and I go in and look, and that's because this still says 11 p.m. All right, so what we're doing here is we put in the sliding scale, we're putting how many times per day. We already have our call parameters up there. So less than 60 or greater than 350, we're going to call the MD. So that already took care of your call parameter order. That no longer needs to be its own order. Also, the AccuCheck that goes along with this is no longer going to be a separate order either. Your AccuCheck, your sliding scale, and your call parameters are all going to be in this one order. So to finish that out, here's my times. Because if you think about it, you can't give a sliding scale unless you do an AccuCheck, right? Okay. It's repeating daily, which is what we want. My special instructions, I already know I'm going to need to type in an indication. My diagnosis is the aftercare. Now, hopefully I would have like a diabetes diagnosis that I could choose here. I know that I'm typing indication in a lot of these, but just know that you always check your ICD-10 first. And if you find one that fits, you do not need to type in indication. Okay. Now, how we're going to tie the whole thing in is we're going to talk about the AccuCheck on our tasks to record. So we want to know first, what were the results of the AccuCheck, which we have this specific one right here that are results milligram per deciliter. That's the one we want for our AccuChecks. That needs to be first. So what were the results of the AccuCheck? Did I have to give any units? If so, where? What was my site? And lastly, I need to know, did I have to notify the MD, yes or no? So I got my results, milligram per deciliter, units, site, MD notified, yes or no. My flow sheet is set to medications. I'm going to go ahead and change that to diabetic. Ordered by my attending. Order source, again, was written in this case. I'll come down to the bottom and click next. Look how pretty that is, right? If any of you are used to the pharmacy rewrites, you'll remember how your sliding scales would take up half a page and be very difficult to read. So now they're going to look a lot better for you. Everything is good on here, so I'm going to say save and new. All right, at this point, I'm just going to quickly go over a couple more orders and get you started on the right track. So again, if we were doing, all right, let's say that this next order is for knee-high TED hose. They're on in the AM, they're off at bedtime. All right, if we looked at it under prescription, you would not find TED hose as a prescription. I can guarantee you. So what we're going to do is we're going to make this one a general order. So I went through the correct steps. I looked under prescription. I couldn't find it. At that point, my only option was to put it in as a general order. Now, do not get a general order confused with a general flow sheet. Two separate things. All right, a general flow sheet is reserved for all of our FYI orders that we did all through admission. You know, resident free from communicable disease, all that stuff, general flow sheet. A general order can go on any flow sheet that we want it to go on. So right here, my dates are good. Order description, TED hose. My frequency is going to be twice a day. Now you're asking, why is it twice a day? I'm going to put it in as twice a day because in the morning, something needs to happen with it. And at bedtime, something needs to happen with it. So I'm going to put it in as BID. Now, right now, it's set at 8 and 4. Okay, but I'm not stuck with these times. Plus, this is a TED hose, so let's think about it. If I kept that TED hose on at 8 a.m., and let's say I also kept it on at 8 p.m. to remove it at 8 p.m., what are you doing at 8 a.m. and 8 p.m.? All right, so you've got a bunch of nighttime meds you're passing at 8 p.m., plus it's snacks and bedtime for some people. At 8 a.m., you've got breakfast, you've got morning med pass, you have a lot of stuff going on. Another thing to think about is that a knee-high TED hose order is going to go on your treatment sheet, not your medication sheet. So anything that goes on our treatment sheet, just like documentation flow sheet, is going to be shift-based. This allows you the time that you need to be able to sign off on this. So we're going to pick twice a day, but we're not going to stick with times. We're going to change this to shifts. So I've got days and I have evenings. What I'm going to do on this one, so this is a very good example of when I'm going to add rows versus picking boxes down here. The reason for that, if I pick one box down here, so say I pick MLs just like that, when I go ahead and print this off, or when it goes and fires an EMAR, then it will automatically put MLs under every single frequency that I have up here. So if this was every shift, nights, days, evenings, then ML would pop up below each one of them. I don't have to tell it to do 3, because again, that's not what these numbers are for. It would automatically display itself to every frequency up above. So days is doing something different than evenings, right? Days are putting them on, evenings are taking them off. So I can't use any of those boxes down below because then it would, you get it. So my add rows, I'm going to do one for each. I'm going to say on for days, off for evenings. My special instructions, I'm going to go ahead and reiterate that. on in the AM, off at HS. I would have an indication of, let's just say it's edema. Notice that I do not have to pick a diagnosis on a general order. However, that would be helpful. No tasks to records are needed. My flow sheet, I'm going to pick treatments, ordered by my attending, and my order source was written. At this point, I'll say next. So here's my TED hose, on in the AM, off in the evenings. Again, on in the AM, off at HS, indication edema, and save and no. All right, so the next order that we're going to do, we're going to go off the chart on this one. I'm going to do a prescription order, and I'm going to show you how we're going to put in a fentanyl. So fentanyl transdermal, let's say it's this 12 microgram right here. So here's my receive date, here's my start date. So I need to make sure I have that patch if I'm going to make my start date today. If this is something that was not in my EDK or my Pyxis, I need to order it from pharmacy. What I would do is just make my start date tomorrow. That way they could deliver it tonight to me, and we could begin tomorrow. My amount to administer, 12 micrograms. My route is transdermal. My frequency, okay, so if this order was for every 72 hours. All right, so look at the frequencies that we have right here. And do you see anything that is going to work? We've got every 4 hours, 6, 8, and 12. Nothing in there says 72. So these are the easy ones. If you have an order that's every 4, 6, 8, or 12, you just pick this, and it's already set up to do exactly what you want it to do. But just like I was talking about earlier with these frequencies, you're not committed, you're not set to whatever one you pick. You can always manipulate things. So let's just say I'm going to pick every 4 hours. Now we know that this is every 72 hours, but right now I have Q4, and right here it tells me every 4 hours. So what I'm going to do is come over here to this specify hours 1 through 72. I'm going to change that to a 72. Notice when I did that, now this says every 72 hours. This is saying at 12 a.m. that we're going to put the patch on. So if that were the case, I would leave it. Otherwise, I could change this. Let's say it was 8 a.m. Okay, so I'm going to apply my patch at 8 a.m. every 3 days. It does not give me an option to do my repeats, the daily, cyclical, weekly, monthly, because I already said that it's going to be every 72 hours. There's my diagnosis. My indication would be pain of some sort, I'm sure. Now, if we're putting something on transdermal, or if we're doing an injection, any of those types of things, not only do we want your signature, but we want to know where. So in this case, I would also choose site as my med note. That way I could document where I put the patch. And as a follow-up, I would probably even go in here to add a general order after this and just make a Q shift order that is to monitor the placement of the fentanyl patch every single shift to make sure it's still there. Flow sheet is medications, ordered by, attending, order source written. Good deal. I will say next. Now I'm looking at my fentanyl order, 12 micrograms every 72 hours. It's going to start tomorrow. And I'm good. Notice that this says Achieve Pharmacy is configured to not allow transmission of this scheduled order. Please communicate this order directly to the pharmacy. So our contracted pharmacies work the exact same way. If you have a scheduled narcotic, you need to get the hard script manually faxed over to the pharmacy. They will not process your order based off of this transmission right here. They need the hard copy. I will say save and new. So I'm just going to go to a general order right here and just show you one or two more things. On the order description, so let's just say this is a medication that needs to be given every 4 hours as needed. So what we would do is we would start with every 4 hours because that's a scheduled part of the frequency. And then if you remember what I was talking about earlier, we would then come down here and pick PRN from this bubble right here after we pick the scheduled part. So now it is every 4 hours as needed. Okay. We rarely pick PRN as needed right here at the bottom. Very rarely do we ever pick this one. So always pick the scheduled part first. Okay. Last thing that we're going to do in here, two more things, I'm sorry. We're going to look at the side effects, and then I'm going to show you how to add a lab. Just one lab, and then from there, you can add labs all day long. It's that easy. So when I'm looking through my orders here, I see that I have a routine pain medication and the fentanyl. I have warfarin, routine warfarin. And if I look down, I really don't have much of anything else as far as medications go. So based off of those two, a routine pain med and an anticoagulant, I'm going to go to add orders. Type of order, I'm going to come down here to my side effects list. I'll say next. So these are built just like all the other standard orders. They look very familiar, right? First one's hypnotic sedative tranquilizer. I don't have one for that, so I'm going to keep moving. Anticonvulsant, I do not have one for that. I'll keep moving. Lithium, nope. That one is methylphenidate, no. Antipsychotic, I do not have one. I do not have an anti-anxiety med or an antidepressant. There's my anticoagulant. I want to wake that up. We monitor every shift when it comes to side effects. Okay, so we're not just monitoring when we give the medication. That medication is in their body 24/7 once we put it in there. So we monitor around the clock for these side effects. Now, instead of just like that really generic order that you had previously, this one, observe resident closely for bleeding gums, nosebleed, rectal or vaginal bleeding, severe or uncontrollable bleeding, hematuria, red or black stools, bruises of unknown origin or spreading bruises, hemoptysis, hematemesis, or coffee ground emesis, warfarin drug interactions. Clotting times may be affected by antibiotics or antifungals. So that really breaks it down for you as to what you need to be looking for. Some of those are hard to say, right? Flow sheet. We're going to go with, this is a shift-based order that would go on the MAR. So where do we put it? Documentation. You got it. Ordered by, again, this is a nursing order, so I'll pick my name. And then here we have monitor effectiveness of pain medication Q shift. Yes or no. If no, complete a pain assessment and notify the MD. So we're only going to pick this monitor for effectiveness of pain med side effect for if the resident has a routine pain medication. So I'm going to wake that up, and they do because they have the fentanyl, and it's already set nights, days, evenings. And if you notice, we already dropped a row that says yes and no. This is the only one out of the side effects where this yes and no is required. All the rest don't have them. Notice that it's not in my anticoagulant because all the order is saying is that you are going to monitor for these things. If you notice any of those side effects, then you're going to contact the doctor immediately. You're going to write a progress note about it. That is your follow-up. This one wants to know, was the routine pain med effective? Yes or no? So we're going to leave this one as is. Again, change the flow sheet to documentation. Pick my attending. I will say save. And now I have side effects that I need to sign off on as well. So there's my anticoagulant. And there's my monitor effectiveness of pain. All right, so we're going to look at an antibiotic order. This is one of the hardest orders you're going to have to put in the system. So I'm going to add an order. I'm going to go with prescription. I'm going to pick amoxicillin. So let's say that I'm doing the 500 milligram tablet. Now here it says the use of amoxicillin oral tablet 500 may result in allergic reaction based on a reported history of allergy to penicillins. So this is the contraindication message that I was talking about earlier. When we pick our allergies, this is what will pop up if we have something that is pulling one of those allergies and saying that, hey, they might have a reaction to this. So if that were the case and I got this message, I would call the doctor And I would tell the doctor, hey, they have an allergy to penicillins. You wrote an order for amoxicillin. And the prescriber may very well say that they are aware of the potential risk and the resident's condition will be monitored. There are a few other options down here to choose from. The one that you will never pick, ever, is unable to obtain acknowledgement from the prescriber. Seriously, don't ever pick that one. So prescribers are aware of the potential risk and the resident's condition will be monitored. I'll click next. So here we go. My end date right now, I know that I have one. So let's say this amoxicillin is the 500 milligram tablet. It is every 12 hours, and it's going to be for 7 days. Okay, so every 12 hours is 2 tablets a day for 7 days. That means there's 14 tablets altogether. So if I look down here, my amount to administer is going to be 500 milligrams. Now, I could go ahead and say open-ended and put in my stop date here. One of the common mistakes that happens is someone would think, all right, today's the 10th, so automatically I'm going to pick the 17th as the stop date if it's only for 7 days. Well, if we're doing this order in the morning and say our 12 hours is 8 and 8, okay, and we're putting in this order at 7 o'clock in the morning, well, that first dose that we're going to give, because per our policy, we need to give the first administration of an antibiotic within 2 hours of receiving the order, then your first dose would be 8 o'clock a.m., your second dose would be 8 p.m. So that'd be day 1, day 2, day 3, day 4, day 5, day 6, day 7. Your order would actually end at 8 p.m. on the 16th if you got in the 2 doses today. So picking the 17th straight from the calendar is a huge mistake that happens quite often. So if you are going to manually put in your stop date, please open up your calendar and do the math. Instead of doing that, I'm going to show you how we can make the computer automatically put a stop date for us. So my frequency, we said it was every 12 hours. So on this, by 12 hours are 6 and 6. Okay. Right now it is 5 o'clock in the evening. So I missed my 6 a.m. dose, but my first dose is close enough to be my 6 p.m. dose here. So in this case, since we're only doing 1 dose today, our order actually will carry into the 17th and end after the 6 a.m. dose on the 17th. So up here at the top, it says specify number of administrations, 14. Okay. Down here at the bottom, I said we wouldn't have to mess with these until we got to an antibiotic. So select the first scheduled administration on 11/10/2015. I check that box and it gives me 2 options. So what's the first scheduled administration that I'm going to be giving? It will be my 6 p.m. This says indicate other initial administration or override time on 11/10/2015. Now to get the full experience of this order, I'm going to go ahead and come up here and say that my every 12 hours is 9 and 9. Okay. With it being 5 o'clock right now, I was too close to that 6 o'clock window for this to work the exact way that I wanted it to. So if this is at 9 and 9, notice it gave me a third option down here. So what I'm going to do is I'm going to give that loading dose as soon as possible. And then I'm going to pick up on this 9 p.m. dose today. So in this scenario, they will get their 2 doses today, meaning that the order is going to stop on the 16th. So again, select the first scheduled administration on 11/10/2015. So the first scheduled one is talking about one of these 2. That 9 p.m. is going to be my first scheduled one that I actually get to give today. The next box says indicate other initial administration or override time on 11/10/2015. So that's talking about my loading dose right now. I'm going to select the box for that. It is 5:07 p.m. So I'm going to give myself a little bit of time. I'll say 5:30 p.m. To the right of that, it says override time is the only administration on 11/10. Not the case. Because again, we have our 9 p.m. dose that we're going to give. Select the last scheduled administration on 11/16/2015. So there's my stop date that it automatically came up with. When I check that box, if I did my math correctly, it would show up for my 9 p.m. dose on 11/16. I know that I've done this order correctly. All right, so let's say that my indication for this was a UTI. Again, I have to pick a diagnosis. The only one I had to choose was the aftercare, which is why I did the indication. Task to record. Some people would say, well, we want to record a temperature with this. If we are giving a resident antibiotic for a UTI, then you are already doing hot charting for this through the infection control. The antibiotic would be attached to that hot charting, and you're going to record your temperature through the hot charting. So there's no reason to do it twice. So we're not going to select that. My flow sheet is medication ordered by my attending, my order source written. And then down here at the bottom, this is where we get into the taken from emergency supply. So we're going to do this 5:30 dose here in the next 22 minutes. Then we have a 9 p.m. dose. Okay, we don't have this on hand, but it is in the EDK or the Pyxis. So I know that I'm going to give the first dose here at 5:30, and we're going to have to give a second dose at 9 p.m. That's before pharmacy gets here. Pharmacy rolls in at about 1 a.m. So I need to tell pharmacy that I'm going to go ahead, and by the time they get here, 2 doses are going to be taken from the Pyxis. That way, they're only going to send me 12 tablets as opposed to 14. So I'm going to take 2 from there. I'll say next. Come down to the bottom. Everything looks good. I'm going to say save and new. And the last thing we're going to do to wrap up is we're going to put in a lab. So I'm going to go to my lab order. I'll click next. So let's say that this lab is scheduled for next Tuesday. So today's the 10th. It was received today, but I'm going to give it on the 17th. And let's say that's a CBC with diff. Okay, we could pick any of these in here. This is a lot, you have a lot fewer options in the training than you do in your actual building. So this list is quite long for you. My frequency, when you are working, the only 2 you're going to have an option to pick are lab or a one-time lab. A one-time lab means that it is going to be drawn once and it's done. Lab would mean that it's ongoing and it's every 6 months, however the case may be. So in this case, it's a one-time lab. So once one time, it automatically tells me 4 a.m. to 11 a.m. That's pretty much the standard for every building that we work with. There are some variations. But that gives enough time for whoever your lab company is. They like to come in early. That gives them a bigger window. So they've got a 7-hour window to come in, draw the lab. And really that 7-hour window is for you as a nurse to have that much time to sign off in EMAR or on your paper MAR saying that they did come in and draw that lab. Again, we would put an indication up here of why we're drawing that CBC. It wants a diagnosis, so hopefully we would have one to choose from right there. My flow sheet, I would put this on labs. Ordered by my attending, my order source was written in this case. I'll click next, double check my work, and if everything is good, I will save.